let's get right into it. We're tackling one of the biggest questions out there for people with diabetes. Can I ever stop my medication? You go online and it's all, yes, reverse it naturally. But then your doctor might be saying, nope, this is for life. So what's the real story here? What does the science actually say? Well, that's what we're going to figure out.
Look, if you're living with diabetes, I am willing to bet this question has popped into your head more than once. And it makes total sense. You want to ease up on the daily pills, the cost, just the mental weight of it all. But trying to get a straight, honest answer can feel, well, impossible sometimes. And this is why it's so frustrating. On one side, you've got these wild claims online promising you can just fix it all with a miracle cure. And on the other, you might hear a very firm no from your doctor. The truth? It's not that simple. It's actually way more nuanced, and it's hiding right there in the middle of those two extremes. Okay, before we go one step further, we have to talk about this, because this is the most critical distinction. The answer to our big question is completely different depending on whether you have type 1 or type 2 diabetes. For type 1, the body makes little to no insulin, period. So stopping it is just not an option. But for type 2, your body is still making insulin. It just isn't using it very well. And that one difference, well, it changes everything.
And let me be absolutely 100% clear on this. For anyone with type 1 diabetes, stopping insulin isn't just a bad idea, it's a life or death situation. It can trigger something called diabetic ketoacidosis, or DKA, and that is a medical emergency that can become fatal in as little as a day. So from this point on, everything we talk about is going to be focused exclusively on type 2 diabetes.
The next thing we need to get straight is the language we use. You'll notice that doctors and researchers don't really say cure. The correct term is remission, and that word perfectly captures the reality of the situation. Remission means your blood sugar is under control without medication, but the underlying condition, the tendency to have high blood sugar, is still there. It's a lot like remission from cancer. It's a huge victory, but it means you always have to be vigilant.
So how possible is this remission thing, really? Well, data from a huge study called the DIRECT trial is pretty eye-opening. After 1 year in an intensive lifestyle program, a whopping 46% of people achieved remission. I mean, that's almost half. That's the good news. But here's the reality check. Look at the 5-year mark. That number drops all the way down to just 13%. So what does that tell us? It tells us that getting into remission is totally possible, but staying there, that's the real challenge.
So what was the secret sauce in that study? What made the difference? The science on this is crystal clear. The single biggest factor, the one thing that matters more than anything else for putting type 2 diabetes into remission, is significant and sustained weight loss. We're talking more than 10 kilograms, which is about 22 pounds.
And hey, if losing 10 kilos is good, losing 15 is even better. This is maybe the most powerful statistic from that whole study. For the people who managed to lose over 15 kilos, that's around 33 pounds, the remission rate after 1 year was an incredible 86%. That's not just a correlation, it's practically a cause and effect relationship. It shows just how directly weight loss impacts this process.
But that incredible 86% number doesn't apply to everybody. The evidence shows that certain people have a much better shot. We're generally talking about someone who is diagnosed fairly recently, say within the last 6 years, someone who's a bit younger, whose pancreas is still working pretty well, and of course someone who has lost that significant amount of weight. The longer you've had diabetes and the more medications you're on, the tougher it gets.
Now, I really have to hammer this next point home. It's so important. Seeing these positive numbers, it might be tempting to think, hey, I can do this, and just stop your pills. Please, do not do that. A very recent study confirms just how dangerous this is. Stopping your medication on your own, without a doctor's supervision and a solid plan, puts you at a much greater risk for serious health problems and even ending up in the hospital.
So, if you can't just stop, what is the safe way to even think about this? Well, it's a step-by-step process, and step 1 is the absolute, non-negotiable first move. Talk to your doctor. You have to prove first to yourself and then to them that you can sustain these lifestyle changes for months. Then you work together to monitor your glucose more closely and come up with a gradual plan to reduce your meds. It is a partnership, not a solo mission.
And a huge part of making that partnership work is bringing data to the table. Think about it. When you can walk into your doctor's office with months of tracked data on your glucose levels and weight trends, you completely change the conversation. You're not just asking, hey, can I stop my meds? You're presenting evidence. You're saying, look, my numbers have been great for 6 months. Can we talk about a plan for the next step?
But wait, there's one last really important piece to this whole puzzle. Let's say you've done everything right. Your blood sugar is perfect, but your doctor still wants you to stay on a certain medication. Why would they do that? Well, it's because many modern diabetes drugs are doing more than just lowering your glucose. Some of these medications, like SGLT2 inhibitors and GLP-1 agonists, have been proven to protect your heart and kidneys, totally separate from their effect on sugar. So your doctor might be keeping you on them for those amazing protective benefits. So let's circle back to the big question. Can you stop your diabetes medication? The honest answer is a hopeful but very conditional maybe. For some people with type 2, remission is a real achievable goal, and it's driven almost entirely by significant weight loss. But remember, it's not a cure. Relapse is common, and it should never ever be attempted without the close guidance of your healthcare team. Because at the end of the day, the goal isn't just to be off medication, it's to be healthy for life.